Welcome, everyone. My name is Chris Hurt. Very glad you're with us. Welcome to what should prove to be a very eye-opening discussion today that you and your loved ones will want to pay close attention to. We are going to explore an incredible breakthrough in brain health that may help you to avoid cognitive decline and also reverse the syndrome of brain fog, memory loss, and extreme cognition failure. This could be what millions of us have literally been waiting for. With me now in studio is Dr. John Lewis. He is an associate professor in the Department of Psychiatry and Behavioral Sciences at the University of Miami Miller School of Medicine, and he is also the founder and president of Dr. Lewis Nutrition. Now, in addition to over 30 long-term nutritional studies during his career, Dr. Lewis ran his landmark study on how an allopolysaccharide multi-nutrient complex improved cognitive and immune functioning in people with moderate to severe cognitive decline, leading to the creation of a dietary supplement called Daily Brain Care. Dr. Lewis, thank you so much for being with us, and please tell me I pronounced all those technical terms correctly.
Thank you, Chris. Great job. It's a pleasure to be here.
This is very exciting work. I'm very intrigued by all of this, and I have to ask you, just get us off on the right foot here. Can you provide us with a snapshot? Where do we, as human beings in our society today, where do we stand on brain health? Is there a problem? And I guess more importantly, is it getting better or is it getting worse?
Wow, Chris, unfortunately, it's a huge problem and it's only getting worse. So you're talking about 5 to 6 million people with Alzheimer's disease, another 8 or so million people with various forms of dementia. Then you have Parkinson's, you have MS, the other two leading neurodegenerative disorders. We're talking about a huge problem in our country today, and it's growing and it's global. So yes, unfortunately, it's a huge problem and it's only getting worse.
All right, clear up another, maybe this is a misconception. I hear a lot about the fact that once you've started down the path of a diagnosis, some sort of cognitive decline, there's really no turning back. And yet I know that you've spent over a decade with what the medical establishment would say are radical theories, and yet I think your theories are proving to be true after all. Can you talk about that?
Absolutely. I hope you're right, because what we've been doing for a very long time, my colleagues and I in my lab, is looking at nutrition, which is a completely different approach to treating someone, if you will. So when you look at the FDA-approved drugs for dementia, they're basically treating one symptom or one disease with one chemical, one synthetic. Nutrition is an entirely different approach to this. We're taking different nutrients and phytonutrients, giving the body literally hundreds, if not thousands of things simultaneously to allow the body to heal and restore itself. That's a completely different approach, and that's the path we've been taking for many years now.
That sounds wonderful. Instead of treating with drugs, the symptoms, as you put it, right, you're actually giving the body what it needs to fight these problems on its own. Have you been frustrated in these attempts to sort of go against the medical establishment? What's that been like? I'm curious.
Oh, frustration is like just the tip of the iceberg.
Yeah.
Chris, it's become my life's mission to spread a message about brain health, to give people hope. I've gone through so many different, let's call them trials and tribulations, of trying to get people to understand the value of nutrition. I mean, I've had my own colleagues tell me, well, John, you're only doing nutritional research. If you're not doing pharma or genetics, you're really kind of like almost a black sheep, really. And so I've literally had people laugh at what I'm doing. But as you said, and hopefully as we continue moving forward, doing more research, we will validate and prove over time that not just this one or this handful of studies we've conducted, but actually many more studies that we will conduct in the future, we will continue showing the value of nutrition and how effective it really is.
Right. Well, for the record, I'm glad that you persevered through all of that frustration.
So
let's talk about the way to change things. If we're going to get ourselves to a point where we're mentally fit, physically fit, so forth, is it going to mean each of us individually turning over a new leaf, making some sort of drastic lifestyle change? Is there some sort of magic pill? I mean, what's going to make a real difference here?
Chris, so what we've done so far with the work that we've been doing with Daily Brain Care, I don't call this a magic bullet. I never will. This is, again, supplying the body the raw materials that it needs to function properly. Every cell in our body, we're a collection of trillions of cells. Every cell needs nutrients to function properly. So we're really giving the body what it needs to heal, repair, restore itself. That's not treating disease. That's giving the body the materials that it needs to function properly.
All right, Daily Brain Care is the name of the supplement. The main ingredient is allopolysaccharide. What is a polysaccharide?
Great question. So if I had said to you, Chris, guess what? Sugars are good for you. You'd have probably thought I was a Looney Tune, right?
A quack.
A quack, exactly. A nobody, right?
Right.
So we are very conditioned to think of sugar as being a bad thing. And granted, if you're consuming too much sucrose or glucose or high fructose corn syrup,
boy.
you know, those are definitely problematic sugars.
Sure.
However, Mother Nature provides us with hundreds of sugars naturally. So we're talking about complex sugars, these long-chain polysaccharides.
And we do need sugars.
Absolutely, we need
Right.
sugars. So what we actually showed with people with moderate to severe cognitive dysfunction is that Daily Brain Care was able to actually reverse cognitive problems with these people. Wow. So you're talking about a very significant approach to, again, reversing cognitive dysfunction, which is really the foundation of these problems that we're discussing today. So when you combine the aspect of improving cognitive function, we didn't even talk about the effects on immune function yet, and then also the increase in the production of adult stem cells, that's really, again, the keys to this product and why it's so effective, because you're actually addressing multiple issues at the same time. Remember, nutrition doesn't work specifically in one particular area of the body. It
Sure.
actually is working head to toe.
Right.
And that's why nutrition works.
It's sad to lose your mother due to memory loss because some days can be very challenging. I've lost my mom. She doesn't have the same personality. She's not completely there. Very difficult, to have to answer the same question every 30 seconds for an hour, to make sure that they've eaten or if they've showered or combed their hair, brushed their teeth. You have to actually see that they did it because they'll think that they did it and they didn't. It's not physically exhausting as much as it is emotionally and mentally, because you have to, some days you have a rough day at work and you want to snap at them and you know that it's not really them. It's difficult because you can't do the things that you used to do. But, all the activities and camaraderie that as family you would do, whether it's like having a barbecue or just a family dinner, it's all gone. You miss the person they were. That's all. It's like it's like, let's go shopping. Let's go have lunch. Let's go have brunch. And you don't have that anymore. My mom's been using Daily Brain Care for about 2.5 months, and the difference is night and day. She has gone from sitting practically comatose to talking, engaging, making herself, a sandwich or going to get something to drink, and even has volunteered to walk around the block. Yeah, almost immediately within the first week, she seemed calmer and more alert. She started being more aware of her surroundings almost immediately. My brother even told me when he came to visit, because he doesn't live here, that he was shocked that she actually got up and hugged him and was smiling and talking. She doesn't look like a mummy, She's aware. She's back. Mom is back.
I feel better.
Daily Brain Care has changed our lives 100% for the better.
Yes, I am happy. I have my dog here. I love you.
Love you too.
How many of us, think about this, how many of us have experienced the heartbreak of loving parents or grandparents who don't recognize us, forget who we are? Parents and grandparents who suffer so terribly. This may be the chance that we've all been hoping for.
Absolutely. These polysaccharides are so beneficial to practically every cell in the body. They make our cells function. They basically engage the bioengineering of life.
I actually understand that you brought something with you, a little demo that you were going to plan to show us. Can we dive right into that now?
Absolutely, let's do it.
Okay.
So I have your regular common household bucket, and I have from my own backyard
Oh, look at
an
that.
aloe vera leaf.
That's it,
Now imagine this leaf. You see that gel in there?
right?
The gel is where the polysaccharides are. But guess what, Chris? This is about 98.5, 99% water. So imagine you'd have to fill up an entire bucket with all of this gel to get the same amount of polysaccharide content as you get in one scoop of daily brain care.
Are you kidding me?
Yes.
That's amazing. I was just going to ask what would prevent me from growing my own aloe vera plants and then making my own supplement, but you just added it would take a huge amount.
That's the thing. Like when you want to get a physiological effect from these polysaccharides, you would have to take so much of this gel, literally in buckets, to be able to get that kind of an effect. It's
benefit.
impossible.
Yeah.
Nobody can do that.
Interesting. Now, I noticed, that scoop is much smaller than I anticipated in my mind's eye it would be. How much do you have to take to see some benefit?
So for people who are already in a pretty good health state, I would say 2 a day. So do 1 in the morning, 1 in the afternoon or evening. You can take it with anything. It
Really?
doesn't matter. Yet it doesn't matter if you're already taking other supplements, other medications. You literally can take this product with anything. I personally just scoop it straight into my mouth. I don't even.
No kidding. Bulletproof.
Exactly. I don't even mess with other liquids, but put it in water, juice, your smoothie, yogurt, applesauce. The only thing I tell people not to do is to put it in something at very high heat. Very high heat can damage nutrients.
I see.
And then if you do have a health challenge, double it. Take probably 4 scoops per day. That's what we did in our research. I have had a career over 20 years now at the University of Miami Miller School of Medicine, where I've been one of the few professors who has been conducting research in nutrition, dietary supplements, exercise training. So in my career at the University of Miami, I have probably conducted at least 25, maybe 30 clinical trials looking at all of these various factors related to nutrition, dietary supplements, and exercise. I've published close to 200 peer-reviewed scientific articles. A lot of the key findings were in things that are very significant categories today. For example, Alzheimer's disease, MS. These are 2 of the 3 leading neurodegenerative disorders that, unfortunately for those people, conventional medicine really has no good answer for. But through the power of nutrition, we showed very impressive findings in that area. One of the most exciting studies to date in my career was the study on looking at the effect of this dietary supplement formula, in particular this polysaccharide-based or sugar-based formula on Alzheimer's disease, and we showed quite remarkable findings. After 9 and 12 months of people with moderate to severe disease being on this supplement, we actually showed improvements, clinically and statistically significant improvements in cognitive functioning. That's unheard of. I challenge anyone to find a better study than what we showed in this study with people with moderate to severe Alzheimer's disease. We also showed a lowering of inflammation, inflammatory markers, which are so significant. Inflammation is the underlying aspect of all chronic disease today. And then finally, the other really cool finding in this study was we showed from baseline to 12 months, approximately a 300% increase in adult stem cell production. How about using the power of nutrition to turn on your body's own intelligence to be able to make its own stem cells? That's the power of what this product does, and that's why this product works so well. So as someone who is not only a scientist, but a person who lives this life of health and wellness, it was so exciting to me. The findings that we had in the Alzheimer's study were just so profound. I had caregivers calling me and saying, "Dr. Lewis, I cannot believe what my loved one is doing today. He or she is now remembering names, places, events, things that we did together." These people were calling me in tears, so I get chill bumps every time I tell the story of how the people in this Alzheimer's study responded to basically enhanced nutrition, allowing the cells to function properly and restore and repair the body's damage. So for me as a scientist, it's beyond just what we showed in terms of the data that we published. It's actually the human interest story. It's actually getting that kind of feedback back from the primary caregivers who are so affected. Remember, with Alzheimer's, it's not just the person who gets the disease, but you actually have the caregiver who also gets very sick and ill because it's so stressful taking care of someone with dementia. So the human interest aspect of this was just beyond anything that I had shown in my career to that date, and it has really propelled me and motivated me. It's why I feel so passionate, among other reasons, to help spread this message of health and wellness to the world.
Welcome back, everyone, to our final segment today. We have learned some truly jaw-dropping information that will undoubtedly change the course of millions of lives in this country and beyond for the better. Clearly, Dr. Lewis, thank you for spending some time with us here.
Thank you.
I have a personal question for you. Before our last break, you shared a very touching story about a patient whose life was dramatically improved after taking daily brain care. I'm just curious, how does it feel when you see things like that, success stories? It must be fulfilling.
Chris, it's incredibly fulfilling. It's one thing to run studies and do a bunch of research where maybe it never sees the light of day or maybe it never actually helps people, but I have been blessed with the opportunity to actually do work where I can see the results. And when you have that experience, I mean, that's the top of fulfillment, to be able to not only change one person's life, but actually a whole family's life and make a difference for those folks. That is the embodiment of fulfillment.
And I'm so glad. I keep forgetting, you keep reminding us you're good to do that. It's not just one person that you're helping here. You are improving their entire family's experience and the time they have to spend together, however long that time may be. It's just incredible. Have we left anything out here today? What else would you like viewers to know?
Really, just to sum this up is you don't have to have a health challenge to improve your health. You may be younger, you may feel like you're, in great shape, but the reality is, as we go through life, we will experience something along the way. That's just life, right? So what better way than to take daily brain care? Again, it's not just about the brain, but it's about having a quality of life for your entire life, and doing that with nutrition, with this ability to give all the cells the body needs to function properly. Try to prevent those diseases in the first place. So don't just think about it as a restorative measure. Think about prevention as well. That's so important for all of us.
Another excellent point. I just wanted to say, in the time we got left, it's been enlightening. It's been a privilege, really, to have you here talking to us about this very important subject, and I'm going to be looking forward to the months and years ahead and hearing about more success stories out there. It's important work.
Thank you.
And we're so glad that you're doing it. Friends, you have a rare opportunity before you today to change what was once considered inevitable cognitive decline, or just getting old, into a life of deliberate thought, clear intentions, and greater focus and clarity. You have the chance to stay young at heart by avoiding the fog of memory loss and confusion. Daily brain care can help. Go ahead and order your daily brain care today. Your success story is waiting for you. Thanks for joining us.